What up, guys? Welcome to another episode of PT. Thanks.
In this episode, we're here to talk about the possible treatments and interventions we can use for adhesive capsulitis. So first, before we do any treatments or anything, we must know how to assess the patient to confirm if it's adhesive capsulitis or just a plain shoulder pain. So first, we must palpate the affected side to see if there's any tenderness or anything like that, or compared to the other side. And next, we must find out the gross range of motion of the movement of the shoulder, especially the capsular pattern of your GH joint, which is your external rotation, abduction, and your internal rotation. We could also use passive range of motion to find out the patient's capabilities and the end fields of each movement. And we could also use different special tests to confirm and to accurately tell the patient's situation. So now we're here to talk about the possible treatments that we could do for the 3 stages of adhesive capsulitis, which is the freezing, the frozen, and the thawing. First, we must talk about the freezing stage. And the freezing stage is considered to be the most painful out of all the stages. So we must be aware of that. So we must first use heating modalities to probably relieve the pain before any exercises. For the exercises, we must first use the information about the patient's capabilities. So we plan exercises and we do them in a pain-free range, so we don't aggravate the condition. So exercises such as shoulder flexion or assistive flexion with the help of another person or help of an external device such as a wand is advised. We could also use the wand as externally rotate the arm, and we could also use an exercise, the pendulum swing, which is where you let the arms hang and then you just swing the arms back and forth. We can also do the pendulum swing in an adducted way. This is to maintain the movements of the capsular pattern, so we don't atrophy any muscles or lose any more range of motion.
So for the frozen stage of the adhesive capsulitis, we would recommend stretching exercises and a little bit of strengthening exercises. We will start this exercise to promote and increase the strength, to regain the strength of the shoulder of the patient. By the way, frozen stage, this is where the shoulder is completely frozen and all the range of motions are limited. So before doing any exercises, we should always apply modalities such as heat or cold packs on the shoulder to increase the muscle extensibility and to prepare it for the exercises that we're going to use. For the exercises, we can do stretching exercises for the chest muscles and the muscles of the back of the shoulder for the range of motion to be maintained. For the start of the strengthening exercises, we can add a little isometric or static movement exercises wherein the joint will not move but there will be contraction of a muscle. Scapular retraction exercises can be a good start to exercise the back muscles and the shoulder muscles. We can also add a little isometric shoulder external rotation where the patient will hold the hand and externally rotate the shoulder while fighting against the force. The last phase of the adhesive capsulitis is the thawing phase, which is where the patient gradually increases his range of motion and gradually goes back to normal. For this, we can recommend strengthening exercises and still stretching exercises. But before that, don't forget to always apply heat or cold packs for increased muscle extensibility. For the strengthening exercises, we should increase the intensity but not too much as to aggravate the patient's condition. For mobility exercises and stretches, we can advise the patient to hold a longer duration or to stretch the muscle longer so that the muscle range of motion will be returned to normal as much as possible. And then for strengthening exercises, we can increase the intensity of the exercise to further strengthen the muscles and regain its strength to its normal state. For this, we can use a resistance bands or even free weights. Just make sure that we don't use too heavy weights as to aggravate the patient's condition and bring back the adhesive capsulitis. And that is the last thing we want for our patients. We don't want that. Home exercise programs are very, very important because we don't see our patients every day. They don't come to our clinic every day, so it's crucial that we advise or prescribe them with home exercises that they can do with assist of their family members or by themselves. A good example of this is the finger walk to the wall, where the patient will train his shoulder flexion, placing his finger on the wall and gradually climbing up like a ladder. That increases the range of motion and the strength of the muscle. Furthermore, we can prescribe light exercises if the towing stage is complete so that the strength of both shoulders will be equal again.
For home exercise program, we can again, we highly recommend the use of heating modalities to relieve the pain of the patient, and then we could also advise the patient to continue doing the exercises such as the arm flexion with wand or any assistance, the internal and external rotation with assistance, and the pendulum swing.
So that's it for today. I hope you learned something. We'll see you again in the next video.